Boris Johnson urged people today not to lose patience with the lockdown, but there's concern that some people are doing just that. Police in North Yorkshire say that they received abuse over the weekend as they tried to turn people away from some beauty spots. So is the lockdown falling apart in some areas? Our North of England correspondent Danny Savage has this report.
The signs have been up for weeks, but after a prolonged period, it seems a minority of people have had enough of lockdown. One police officer on duty this weekend took these pictures near the village of Malham after she put a stop to this barbecue, with a number of visitors from out of the area sitting around it.
That particular party was broken up just over there on top of Malham Cove. One of the police officers on duty here on Saturday has written on social media about what was said to her, and it shows that some people are getting fed up with the lockdown and others just don't want to abide by the restrictions.
Recounting her day on duty, the officer said, "I had to request colleague assistance on several occasions, politely engaging with folk to go back to where they came from, Kent, Barnsley, Bradford, Dewsbury, Accrington. I endured more abuse than I ever have dealing with drunken idiots outside nightclubs." It's come as little surprise to the manager of one of the pubs in the village.
There's a lot of vulnerable people in the village, a lot of farmers, it's their livelihoods, they can't be ill. They need to be out there looking after their livestock, and quite a lot of older people in the village as well. So the locals are really concerned.
It's also felt that police motoring advice, in which it states the time you spend driving should not exceed the time you spend exercising, has muddied the waters.
People feel more righteous and they have got a copy of the guidelines that have been issued, and they are taping them to their windscreens, and they are challenging officers when officers are trying to encourage them to go back home.
It's perhaps no surprise that people in urban areas are growing frustrated with the restrictions. Carol, who lives in Leeds, is sticking to them, but says it's hard.
Because we don't even have balconies, so we can't sit on the balconies. And they do assume that everybody's got a garden but we haven't. All we got is a communal green where we can go.
The rules surrounding going out haven't changed, but the last few days have shown that some people's interpretation of them has. Danny Savage, BBC News, North Yorkshire.
So the biggest challenge for ministers and senior medical and scientific advisors is agreeing a detailed strategy for relaxing the lockdown. And Boris Johnson said today that ministers would be outlining plans for the next stage over the coming days. So what are the main options for a gradual lifting of the lockdown, and what does the experience of other countries tell us? Our science editor David Shukman has been investigating.
Week after week, the eerie sight of lockdown, while behind the scenes governments all over the world desperately try to find a safe way out of it. Switzerland has allowed hairdressers to reopen. Everyone has to wear a mask. It's a cautious first step. No country is rushing into this. In Beijing, secondary schools have started again. There's no sitting close together because all the time there's the risk of the virus striking again. Everything about what happens next hinges on the rate of infection, what scientists call the R number. At the height of the outbreak in the UK, it was about 3, meaning anyone infected was passing it on to, on average, 3 others. So the outbreak was accelerating. Well, since then, restrictions have driven that rate right down to something like 0.7. That's only a rough estimate, but crucially, it's below the level of 1. At that point, anyone infected only infects one other person, meaning that there's no escalation in the outbreak. But look what happens if you relax the lockdown. Suddenly, the rate jumps right back up again, risking a second wave of infections. An essential first move to get out of this is testing for the virus. In Germany, teams are out checking who's had the infection and who's got it right now. The aim is to quickly spot new outbreaks, a difficult job even in countries that have done really well, like New Zealand.
To succeed, we must hunt down the last few cases of the virus. This is like looking for a needle in a haystack, and we need your help to finish the job we have started.
The next vital move is tracing the contacts of anyone infected. In China, a small army was drafted in to follow up anyone who might have caught the virus. There's a plan for 18,000 people to do the same in the UK. Also, to use apps to help with the task. And if it all works, it'll make it easier to relax the lockdown.
if an app comes along, then clearly it's really important that the public are part of that, because the app just won't work and be effective unless lots of us use it. And that requires the government to communicate with us, to tell us what their plan is and what we need to do to help with this.
And if contact tracing finds more infected people, then they'll have to self-isolate. Patients may wear thin if this drags on into next year, but the alternative is maintaining the entire national lockdown.
We have really two choices as a country. Either we can all be locked down all the time to make sure there isn't infection spread, or we can just lock ourselves down for the much shorter periods of time when we may have been in contact with the infection.
Whatever happens, we all face a new kind of normality. In a hospital in Greece, a birthday cake delivered in full protective equipment. Lockdowns will eventually be relaxed, but that won't happen quickly. David Shukman, BBC News.
Well, some health workers are still struggling to get tested for coronavirus. That's the warning from the British Medical Association. It says that since the government increased the number of people eligible for testing to 10 million key workers and their families, the online system has been fully booked. The government target is to reach 100,000 tests a day by the end of the month. That's in 3 days' time. But yesterday, just 37,000 tests were carried out. As our health editor, Hugh tells us.
The army testing for coronavirus, part of the plan to allow up to 10 million essential workers and their families to get tested if they have symptoms. Elsewhere at drive-in centres like this, people arrived for tests booked online. On the launch day last week, the service was suspended with all the slots taken, but they were open today. What do you think of the process of the booking and coming here?
It was quite easy, I would say. It's a bit nerve-wracking because obviously there's going to be quite a few people with symptoms and things like that around here, so that was our only concern. But other than that, it was quite easy, straightforward.
It's been simple. It's not been as bad as I thought, as I imagined.
And easy to book online?
Yeah, quite straightforward.
There's been a fairly regular flow of vehicles at this centre, with things going, it seems, quite smoothly. But that's not necessarily the case, based on what we've been told in other areas of the country and other parts of the system.
Just trying to log on for the fourth occasion.
Kevin from Liverpool has symptoms, but the only tests he's been offered are some way from his home.
Doncaster and York and Edgbaston. When there's a test centre which is up in Haydock, which is roughly about 15 miles away from myself, it's just not good enough.
The Health Secretary said they were still on track to meet the target of 100,000 tests a day later this week. But where to from there? Where do you want to be with capacity and testing ability in a few months' time?
We want testing to continue to increase. As you'll know, the Prime Minister set a goal of 250,000 some time ago. We're making sure that now NHS staff get tested, including when they're asymptomatic, to make sure that we understand whether people who are working in hospitals have got the virus.
Future testing, along with tracing of patients' contacts, will be crucial to try to curb any spread of the virus as lockdown measures are progressively lifted.